The beginning of wound care is cleaning a wound. First, you scrub your hands with soap and water and put on gloves. Then you see if the wound is an open wound. You clean the wound by irrigating with water and using a mild soap. Then, if it's a puncture, then seek medical attention. If it's bleeding for more than 1 hour, you seek medical care. Open wounds are any wounds that break the surface. Amputations are wounds that tear away a body part from the rest of the body. Blisters are a bubble under the skin that is mostly fluid. And then nailed or embedded object is what happens with a puncture.
A closed wound happens when a blunt object strikes the body. In other words, the skin is not broken, but tissues and blood vessels beneath the skin surface are crushed, causing bleeding within a confined area. There are 3 types of blood wounds: bruises and contusion. At this point, you will probably have to decide whether medical care is needed for a wounded victim. As the guidelines, seek medical care for the following conditions, as offered by the American College of Emergency Physicians. Wounds that will not stop bleeding after 5 minutes of applying direct pressure, longer deep cuts that need stitches, cuts over a joint, cuts that may impair function of a body such area as an eyelid or lip, cuts that remove all the layers of the skin, such as from slicing off the tip of a finger. Guns are abundant in the United States. It is estimated that there are 1/2 of all Americans' homes have a firearm. There are 2 general types of firearms: low velocity, such as most victims' firearms, and high velocity, such as military weapons. Shotguns have low velocity but create severe tissue damage. A bullet caused injury in the following ways depending on its velocity or speed.
The purpose of using a dressing are to A. Control bleeding, B. Prevent infection and contamination, C. Absorb blood and wound drainage, and D. Protect the wound from further injury. Bandages. A bandage should not be clean but does not need to be sterile. A bandage can be used to 1. Hold a dressing in place over an open wound, 2. Apply direct pressure over a dressing to control bleeding, 3. Prevent or reduce swelling. The signs that a bandage is too tight include 1. Blue tinge of the fingernails or toenails, blue or pale skin, 3. Tingling or loss of sensation, 4. Coldness of the extremity, 5. Ability to move the fingers or toes, 6. A pulse could be felt before bandaging but not after. A square knot is preferred because it's neat, holds well, and can be easily untied. However, the type of knot is not important. If the knot or bandage is likely to cause a victim discomfort, a pad should be placed between the knot or the bandage and the body. Types of bandages. These are the basic types of bandages. 1. Roller bandages come in various widths, lengths, and types of materials. For the best results, use different widths for different body areas. A. 1 inch width for fingers. B. 2 inch width for wrists, hands, and feet. 3. 3 inch width for ankles, elbows, and arms. 4. 4 inch widths for knees and legs. Self-adhering conforming bandages comes as rolls of slightly elastic gauze-like material in various widths. Their self-adherent quality makes them easy to use. Gauze rollers are cotton, ridge-like, and non-elastic. They come in various widths, 1, 2, and 3 inches, and usually are 10 yards long. When commercial roller bandages are available, you can improvise bandages from belts, neckties, or straps of cloth torn from a sheet or similar material. Elastic roller bandages are used for compression on sprains, strains, and contusions, and come in various widths. Elastic bandages are not usually applied over dressing covering a wound. Triangular bandages are available commercially or can be made from a 36, to a 40-inch square of pre-shrunk cotton muslin. Instead of applying a cravat bandage, can be applied to the head, forehead, ear, eyes, arm, leg, or hand. Apply a cravat bandage to the arm or leg using the cravat method. Follow the steps. 1. Wrap the center of the bandage over the dressing. 2. With one end, make one turn going up the extremity and another turn going down. 3. Tie the bandage off over the dressing. When applying a roller bandage, the easiest way to perform the two main methods are by using a self-adhering conforming rolling bandage. This is easier than using a standard gauze roll, crevat, or triangle bandage. There are many different classifications of burns. There is thermal or heat burns, chemical burns, and electrical burns. Thermal burns come in 3 different degrees, depending on the severity and depth of the burn. A chemical burn is caused by touching a corrosive or caustic substance and are washed off by chemical showers. Electrical burns are from an electrical shock and is soothed by leaving the affected area alone.
Cravat method of bandaging an arm. Step 1. Wrap the bandage over the dressing. Step 2. With one end, make one turn going up the extremity and another turn going down. Step 3. Tie the bandage off over the dressing. That is the cravat method of bandaging an arm.
This is the cravat method for applying a bandage to the palm of the hand. 1. Fill the hand with a bulky dressing or pad. Step 2. Wrap the bandage, crossing over the fingers, and around the wrist. Step 3. Tie off the bandage at the wrist.
That is the cravat method of applying a bandage to the palm of the hand.
The figure of 8 method of bandaging a knee or elbow, in this case is an elbow. First, bend the elbow or knee slightly and make 2 straight anchoring turns with the bandage over the elbow point or kneecap. Second, bring the bandage above the joint to the upper arm or leg and make 1 turn covering half or 3/4 of the bandage from the first turn. Third, bring the bandage just under the thumb and make 1 turn around the lower arm or leg, covering half to 3/4 of the first straight turn. Fourth, continue altering the turns in a figure of 8 by covering the previous layers. Fifth, altering turns above and below the point or tip of elbow. This completes the figure of 8 method of bandaging an elbow.